Hello, good afternoon, everyone. My name is Joshua Martinez, and I am the Health Equity uh, Director for the American Diabetes Association here in Albuquerque, New Mexico. I'm so happy to be with you all this afternoon. I have two very special guests also with me from Native Health Initiative, and I'll get to them shortly, but I just want to talk a little bit about what we're doing here today. Today, we're going to be discussing some efforts that we are a part of. As a part of the American Diabetes Association here in New Mexico, we're also associated with a collaboration for equitable health. This is something that was brought about by the Bank of America. It is funded by the Bank of America, and it brings together the American Diabetes Association, the American Cancer Society, and the American Heart Association, as well as the University of Michigan School of Public Health. And really, what it does is it aims to improve health outcomes in communities of color, specifically focusing on heart disease, cancer, stroke, and diabetes. So, this work of health equity is so important to us across the country. And of course, here in Albuquerque, New Mexico, where we're the only minority majority state. So, the majority of us here in New Mexico are Hispanic. And we also have a large population of Native American people in several tribes across the state. And so, with us today, with that, we have an organization that we're partnering with called Native Health Initiative. And we have Ms. Jessica Begay and Jules McCabe here with us. So, why don't you introduce yourself?
Yeah, thanks, Josh. Thanks for having us. Yeah, so my name is Jessica Begay. I'm the program manager for Running Medicine, which is one of the several programs of Native Health Initiative.
Yeah, thank you, Joshua. Yat she Jules McCabe Kitla Cheatney Nishla, Nakai Bashashin, Skabaha Dashache, Turich Eatney Dashanale. Hi, everybody. My name is Jules McCabe. I am the Associate Director of Native Health Initiative. Like Jess, I also oversee many of the different programs within Native Health Initiative that I am excited to share with you all later today.
Awesome. Thank you so much for being with us today. It's so exciting. The work that you all do is awesome. And as we talk about health equity, what does that mean to each of you?
I'll go
Just,
first.
yeah.
So health equity to me, I think, if correct me if I'm wrong, it's really defined as attaining the highest amount of access to health and wellness programs, regardless of your gender, your ethnicity, financial background, economic status, housing status. It's taking all of those things out and just providing an individual with the most relevant healthcare and the highest quality healthcare. And and that healthcare can translate into several different areas, not just medical costs, but it can be medical, dental, vision, mental well-being, physical well-being. So having access to all of those at the highest quality standards, regardless of an individual's different types of status.
Perfect. Yes, I think you're spot on there. Jules, do you have anything else to add about health equity?
Yeah, so for me, health equity, what it means is that it's the fair opportunity for people to be at their highest level of health, like how Jess was explaining. Not everybody has been equipped with the means to attain that highest level of health, and that's from being from different backgrounds, having or not having resources or specific types of resources plays a role in that, like the social determinants of health, as Jessica was explaining. So that is what health equity is to me.
That's great. Yeah. And really, to me, same as what you both kind of mentioned, is really allowing everyone access to health resources, health information, health care, all of these things that are under this big umbrella of health. That everyone has access to that, no matter what, no
Mhm.
matter, like you've said, socioeconomic status, no matter the color of your skin, no matter um, any of those things, that all of us, have access to the things that we need. I also, actually, the founder of NHI, Dr. Flegg, when he talks about health equity, he says there's three things. It's unjust. Health equity is unjust, unfair, and preventable, which is three words that really sums up health equity. And it's unjust, unfair, and it's definitely preventable. So, with that, why is it so important to address health equity? Why is it so important to work in this space? Because in my job, yes, my title is health equity director, so I am directly linked to it and working in this. But in your roles, it's prevalent there too. So why is it so important to work in this space?
Go ahead. I'll let Jules go first.
Okay. um, in my role with NHI, I interact with the youth a lot. I work with primarily our youth-based programs. So when I go out for our Breed Tradition and Addiction programs, and I go out to the different schools, and I talk about tobacco education, and I see the different schools that we're going into, um, the different areas, reservations, off reservations in the cities. It's important for us to realize the reality of what our youth live in wherever they are, throughout New Mexico. Same with our Healers of Tomorrow students as well, our mentees. They come from all over New Mexico, and these are things that they want to learn about, that they have a passion to learn about, that they have a passion to address these things, as they are our next generation of leaders. Um, and so it is important for us to talk about the reality that we live in, and talk about how do we work together to promote health equity, and where does that start in our youth.
Okay, anything to add, Jessica, on the importance of health equity and in your work
Mhm.
specifically, and the work that NHI does, Native Health Initiative does?
Yeah, I think similar to Jules. I'm not too sure if you'd noticed, but NHI, we do focus a lot on our youth. But I think what makes running medicine special is that the founders, Dr. Flegg and his wife, when they first started this, they just wanted to create a community where people can just come out and have something supportive, but also something that was family involved. You know, instead of having to drop your kids off at an event so they can practice, and then you go sit down in the car and watch Netflix or something, you know,
Mhm.
which is fine. But with running medicine, we're more inclusive with the family as a whole, and we're really encouraging the community aspect. And so where health equity comes in, we're just trying to build a community where it's affordable, because you don't have to. There's a lot that you can do, and Dr. Flegg is right. It health equity is totally it's preventable. There's a lot of steps that we can do, and our small role right now is just to make it accessible in the means of financial, in terms of finances, but also in terms of just we don't need a fancy a fancy facility to go run a mile.
Mhm.
And for some people, and that's great if you can afford that. But the reality of New Mexico and the Southwest, the average salary is what, $50,000, I would say, is per year. A lot of that isn't really accessible. Personal trainers aren't accessible. HIIT classes aren't accessible. Weight training is not accessible if you're not living above those means here in New Mexico. And so what we like to do is we're just providing opportunities for people that want to have access to a healthy lifestyle and have people that are trained specially to give back to the community in that way. Just as we have specialized we have certified HIIT coaches, we have certified youth coaches, and even just reaching into your own communities too, just to encourage others too, like, hey, you can do it. And so I think that's kind of where we're at. How I see the program in terms of health equity is just using the community aspect to encourage each other to become more healthy in all aspects, not just physical, but there's a lot of aspects that go into mental well-being and spiritual well-being and stuff like that. So that's kind of how I see like our role in terms of health equity at Running Medicine.
Sure. Yeah. No, that's great. And I've been to several runs with you all, and it's really great to see um, all ages really
Mhm.
that attend these events. So you have little ones who are actually in strollers and stuff, and you have their mom, and then you have their grandma. So it's really multi-generational. So allowing access, yes, it's affordable, but it's open to everyone, right? It's open to all ages, and there's really all ages
Mhm.
that participate. So I mean that is really great.
Mhm.
Um, and so moving on, I'd like to ask you, how have you seen health inequities disproportionately affect your specific community, the Native American population? Um, how has how have you seen that been affected?
So for myself, I've been here in Albuquerque, New Mexico since 2011, but prior to that, I grew up in Fort Defiance, Arizona, pretty much all of my life. Um, I've also been familiar with the Crown Point area, and so I've that's my background. My background is the stereotypical like reservation life, and as much as I appreciate it, I appreciate every single aspect of my upbringing and my community and the village, quote unquote, that raised me. Um, and I'm thankful to be in a position where I can give back. And so to answer your question, Josh, I've seen so much in access to health equity just because of from my upbringing to then up until honestly recently I've been utilizing the IHS system. And although it is a great concept, there's a lot of things in that realm that are inaccessible, whether and a lot of it becomes down to honestly socioeconomic status. And you're looking at the statistics of Native Americans, and you're putting them in boxes in terms of economic status and financial status and even just physical health. But there's a lot of fine lines, especially when it comes to the indigenous communities. And then when it comes to chronic disease, there's a lot of I've seen even educational status. I'm going to say that one. Um, I've, I've, I've unfortunately have seen a lot of the terms of educational status become kind of like the determining factor of whether or not you get the proper care or not. And it's not in a sense of a provider issue, but it's more of a the receiving of the healthcare, meaning like if you don't speak the language and if English isn't your primary language, I've seen that affect people too. And um, educational status. My my grandparents received no more than a sixth grade education, And so they've found it hard themselves to be able um, to just feel comfortable to walk into a clinic of sorts to receive proper care. You know, either myself or my parents will have to go with them. So I've seen this happen, and a lot of it has just been from my own perspective. I feel like a lot of it is preventable in the sense where we can, um, again, just provide that safe area of a community where, yeah, you may not have a certain education, you may not have a certain like type of housing or whatever, but you're still welcome to come into this bubble, and you're still welcome. We'll do everything we can to help you get to where you should be. So yeah, I've seen it. Sorry, it's kind of a long answer, but I've seen it. Like there's so many ways we could do a whole nother video on the ways that I've seen it with my people. So.
Sure. Jules, anything to add on that?
Yes. So similar to what Jessica said, we could definitely, that question alone could be a whole interview right there.
Mhm.
Um, I was fortunate enough to grow up where I grew up half living on the reservation with my grandmother, my aunts, my uncles, my grandmother's siblings, her brothers, her sisters, my cousins, my extended family, and then also getting to live with my parents in the city in Phoenix with my brother. So growing up, I was kind of, I like to say I was tossed back and forth between the two.
Mhm.
So whenever I wasn't in school, I was on the reservation with my grandma. I was with her the whole time. Um, and so growing up, seeing both sides, our cultural ways and then the Western ways, there's a lot that is going on that affects us.
Mhm.
Where we grew up on the reservation, it's a very rural area, literally dirt road, no running water. Even to this day in 2024, we do not have running water in the home that I grew up in. We didn't get electricity probably till I was about 9 or 10 years old. We didn't have cell service. When I was on the reservation, I really didn't have much contact with my mom and dad. Growing up when I was with my grandmother and my extended family. So, and when we think about the reservation and how much of a food desert it is, the closest grocery store to us was probably in Fort Defiance, actually, Jess, because I grew up in Greasewood Springs, Arizona. So that's like an hour and a half away. And then the nearest hospital too, being an hour and a half away. Um, having to travel that much just for healthcare, the mileage that goes into that, having to take a whole day off of work because you need to travel. Half of your day is traveling to get to your appointment and to get back home, from that appointment. Not even being there at the actual appointment. That's just half of it. So seeing that and then being able to go back to the city and where my mom and dad live, we only ever went to the IHS facility in Phoenix, and that was about 20 to 25 minutes away from our apartment. The nearest healthcare facility is probably like less than 5 minutes away, but access to healthcare, having insurance, being able to cover a whole family with health insurance is a lot, and it takes a lot, especially too for a single mother as well. Um, so, and then just thinking about all the things that we've had to undergo, and it really speaks to how resilient Native peoples are, because this isn't something that happened in the past. It's something that's still happening now. um, to speak to my own personal experience, growing up, I was never taken to a dentist. I didn't go to the dentist until I turned 18, right after I graduated high school. And I went in Phoenix. I went to a private dental facility. And when I got there, they were like, "Okay, yeah, your teeth, you're pretty in good in condition, but we would like to have your wisdom teeth removed. Here's the bill." And it was a bill over $6,000. 4,000 of that was to extract each of my four wisdom teeth, and the rest of it was to cover anesthesia. I actually didn't get my wisdom teeth taken out there. I waited till I got here to Albuquerque, and I went to the IHS facility. And that's how that went. Was I went to the IHS facility, got my teeth checked, and they were like, let's schedule for you to get your wisdom teeth taken out. They numbed me up with lidocaine and sent me home with ibuprofen. So that is a much bigger difference than how I would have gotten treated at the private dental facility and how I got treated at the IHS facility. And I think that speaks to the disproportionate health inequity within our community that we see today, and the healthcare that's available, to people who have the health insurance and to
Mhm.
people who may not.
Sure. Yeah. Thank you so much, both of you, for sharing personal stories about yourselves and your families, and the very real situations that many people, like you say, are still going through today in 2024. The health inequities are real, and are still there. And so we're trying in my job, as I mentioned, we try to do what we can to
Mhm.
provide resources and access to all these different health inequities, but all these different health sicknesses, illnesses, diseases that are so prevalent, with our people, Hispanic, Native American, African American. Um, these people are drastically affected by these health outcomes. So, why is the education of chronic diseases, such as diabetes, heart disease, stroke, and cancer, so important? And how do we continue to make sure that people have access and knowledge and support that they need? There's a lot of individuals that have a lot of different issues, aside from health, right? They're trying to make ends meet, right? They
Mhm.
have 2 or 3 jobs, just trying to get any type of food, not even thinking about healthy food, right? Just food to put on the table for their families, so they are working, 2, 3 jobs. Um, but how, can we, and why? How and why is education of these diseases so important, and how can we help our people with these specific ideas?
Yeah, I think it's so important. So again, I'll be vulnerable with you guys. I myself, um, my family history, there is a lot. There's a lot uh, health wise that can exist, and therefore I probably I do my best to be aware that's my genetic heritage, I guess. Um, but it's so important, and I think like for myself, I'm a toxicologist by training, and so I do biomedical research, and so a lot of my background is looking at biological processes and how things in the body work, and how everything is accessible to the body, dose makes the poison, all this other stuff. So for myself, a tactic that we like to do in research is really just providing the general public with resources and information, meaning like we're providing them with the facts, we're giving them the facts, like um so I'll use my own, my family has lot of history of a bunch of other stuff. So chances are that if I don't take care of myself in this way, I am predisposed to different types of chronic diseases. That if those diseases are not taken care of, could progress into different ways. Well, since we're here for American Diabetes Association, let's look at diabetes. A lot of people will say like, oh, if I'm just gonna like whatever, it's fine. you know, it's more of a way of shifting perspective on how you take care of your body, because it's our one and only body. And also too, if yeah, if someone gets diagnosed with diabetes, then there's a lot of potential there. There can be foot issues, there's cardiovascular issues, and as much as you can throw that to the public, you have to kind of sit there and kind of explain too, like, because your sugar is high, this is what's happening at the vascular level when you don't control what it is you're taking in. And so that's something that I myself have had to learn too. And so I think, like, it's so important. Like, for one, it's important to get that information out there, but for two, it's also important to deliver it in a way where they can, where a light will hit and be like, oh, okay, so um, maybe I should go on that 20-minute walk, you know, like maybe I should add a little bit more leafy greens to my diet. And also too, like, not scaring them to the point of like, oh no, I can't absolutely not eat one food. Like, that's not the point. We're not meant to live in fear. And so, giving them a change in perspective of, hey, friend, let me talk to you about this. And this is why X, Y, and Z could happen. And this is why we're trying to get you to push that 20-minute walk. It could change a lot of things. So I think getting that information out there is so important. And for us at Running Medicine, that's kind of the premise of, one of the foundation layers of Running Medicine was just to help decrease chronic disease that could be there. And we've had a lot of testimonials from from current participants and previous participants that have improved their physical health or improved their disease that they're working on in many ways. So, yeah, I'll leave that one there.
Yeah, I think that's very important. And as I, go across the state and here in Albuquerque, it's important to provide the education, right? That,
Mhm.
and we all know, certain foods are not good to eat all the
Mhm.
time. Sodas, not a good idea to drink every day, all
Mhm.
day. There's things that we know, but I think it's also important. And you touched a little bit on this, just it was providing the education in a culturally relevant way, also, right?
Mhm.
Where because we all have different traditions, we all
Mhm.
have different histories and backgrounds of
Mhm.
for an example of how we cook.
Mhm.
Here in New Mexico, food is very important.
Mhm.
To native community as well as the Hispanic community. Food is very important, and recipes and food that has been cooked for generations, and it's not always the healthiest. But how can we explain or talk to um, our parents, our grandparents that maybe there's a different way to do it. Maybe there's
Yeah.
maybe we don't have to eat this certain food every day
Mhm.
in moderation,
Mhm.
those kind of things. But I think um, providing this information in a culturally relevant way is also a very important of getting our message across, right?
Mhm.
Jules, another question for you. And so going back to the collaboration, going back to, us three organizations that are working, being funded by the Bank of America. Tell us how your organization, Native Health Initiative, tell us a little bit about that and your involvement through the collaboration and our partnership that we have.
Mhm. All right. Yeah. So, Native Health Initiative, our mission is to address health inequities within Indigenous communities. We do this by the work of our programs. Currently, we have 7 different programs, Running Medicine being one of them, which Jess is our program manager of. And then 2 that I will highlight are our Healers of Tomorrow program, which is an 8-month mentorship program for high school students who are interested in going into healthcare careers. And then our one of our other programs I'll highlight is our Root Tradition Not Addiction program, which is tobacco education. And I say tobacco education and not tobacco prevention because in our program, when we go out to the different schools, elementary, middle, and high schools, we talk about commercial tobacco and commercial tobacco products, but we also educate about traditional tobacco. Traditional tobacco, specifically, that is used here in the Southwest in New Mexico, from our tribal communities, and what that looks like, and showing them the difference between what commercial tobacco looks like and what traditional tobacco looks like. Um, with our Healers of Tomorrow program, again, that's our mentorship program for our high school students. They get paired up with a mentor who is a healthcare professional or someone who is pursuing a healthcare profession at the graduate level. Um, and so what we aim to do with this program is to continue to provide our students, who are interested in healthcare, information about things like health equity and chronic diseases, like you mentioned, diabetes, heart disease, stroke, cancer, um, and also to educate them about things like prevention and how NHI takes prevention measures. So that could be them coming out to join us with running medicine, getting their families to come out with us, join us on a walk, whether that be they come out walking, they come run with us, they jog with us, they join in on one of our yoga days, or they're interested in one of the HIIT workouts. So, um, but it's also having the getting the access to our students as well for things that they're interested in, like attaining certain types of certification, like CPR certification, AED training, Narcan training, if that's what they're interested in. So through our involvement with the collaboration, we're really looking to continue to expand, each of our programs that we talked about today, in a way to benefit our students, to benefit our community, and to get the information out there about health equity, what it is, what it looks like, um, and also to continue to work on prevention measures for chronic diseases.
Great. That's great. So NHI, Native Health Initiative, is one of our organizations who are receiving supplemental funding from the collaboration. So this is funding that the collaboration has provided to this organization to be able to do exactly as Joel's mentioned, expand already existing programs and resources that they have to offer, and just being able to expand those services, those programs, is something that the collaboration was very much wanting to do. And so, Jessica, through this support, funding support of the collaboration, what do you want to or hope to achieve from this kind of partnership and the support that we've provided?
Yeah. Man, there's so much. I'm really hoping that we can achieve a lot. So first of all, we are let's see. So first of all, with running medicine, we have several different um, areas that we serve. With Albuquerque being being the core group. So we're my hope is to expand, and so we're looking into starting a new program with Crown Point, New Mexico, which will be under the IHS out there, and that will probably be one of our further locations here from Albuquerque. And so what I'm hoping to do is just to help them start up and help them really just incorporate the essence of running medicine into their community and help to encourage their community. Crown Point is I'm from that area, you know, and it's really near and dear to my heart to really just help them get up and going because we're talking about in access to equity and being rural and being distant, and so first and foremost, a lot of the funding is hopefully to get us to um, to be able to be there in person several times a season so that we can be there. I can be there myself, or some of our staff members can be there too to help them with their training, or to even send them specific trainers. You know, we have yoga instructors and our HIIT instructors, or a lot of other the workshops that we have here in Accessible in Albuquerque. We want to take that out to them as well and give them the same opportunities that those in this area have. Um, I'm really hoping to provide further specialized training for our staff members and some of our volunteers, and that can include grant writing courses, coaching specifications, coaching certifications, um, and even just educational trainings for them, and even just cultural trainings for them as well. And one of the key things too with running medicine with our youth, you know, I'm super proud of our youth. They really put in the work, and they put in the work. And each season, we're able to a lot of the youth qualify, and they make it past regionals, and they make it to nationals. And you know, to date, we have up to 10 All-Americans under running medicine's belt, which is super impressive. You know, these kids, they work hard, and so um, we just want to help them and their families financially, that just to take advantage of these opportunities that they have, because you never know. Like, to some people, running is just running, but you know, to us, running is it's an amazing feat in every single way. And so when you're there for these kids, and they want to run at regionals, or they want to run at nationals, because a lot of regionals and nationals don't, they're out of state, and they require travel, which requires a flight, which requires hotels and food. Um, and so here with NHI Running Medicine, we actually provide travel scholarships. And so a lot of what we're hoping to do is just increase these travel scholarships. And for the most part, we don't ask our families their financial or economic status. And if their kids show the potential and they need to travel and they want some assistance, we'll see what we can do, you know. And so that's kind of what I'm hoping to, a lot of that in a nutshell. So yes.
Well, that sounds great, and you know exactly what we want is
Mhm.
right, is to be able to help expand and grow these great programs that you have, and to see more people get involved. You know, like you said, in Crown Point, which is in rural New Mexico,
Mhm.
but allowing them access, right, to a running group, allowing them, you know, the funding that they need to go to some of these races that they might not otherwise have, right?
Mhm.
So that's the whole idea. Again, behind the collaboration and the supplemental funding that we're able to provide to organizations across the country is really just helping expand efforts of organizations that are already doing tremendous work. And so, with that, we are out of time. I know it flies by, but I
Mhm.
just want to thank both of you for being with us today. Really good information, and you know, even personal stories that we heard from you about, you know, the truth about inequities that still
Mhm.
happen in our world today, in our country today, in our state. And so I want to thank you for being here. I want to thank you for the work that you do, the great work that you do, for not only, you know, Native Americans here, but for everyone. And it's such a great organization and so impactful that we're so happy to partner and be a part of what you're doing. So if anyone is interested and wants more information on NHI, Native Health Initiative, of course, they have a website. You can go to just search up Native Health Initiative, and then you can get to all the programs from their website. But also, if you want any information about the collaboration for Equitable Health, you can search that collaboration for Equitable Health, and it'll pop up. Or you can go to each of our agencies' organizations' website. So, American Diabetes Association, and you can search collaboration for Equitable Health there, and you'll be able to see more information about what we're doing, reports of the work that we've done over the years. And if you're interested in being a volunteer or wanting to help, you can also find some information on the websites of how to do that. So again, thank you, ladies, for being with us, and thanks everyone for joining and watching with us today. And have a good day, and thank you very much.